So, Dr. Mehta, you've covered a lot and we've all learned a lot from this session. I'd just like you to maybe look a little bit out into the next 5, 10 years and try and give us some ideas. Do you see any major changes coming from new technology, new ideas that you think might be might change what you do over the next 5 to 10 years?
5 years. No, the biggest stresses or the biggest focus now is preventing a lot of it. So I think that there was a generation, perhaps my father's generation and myself, where we just focused on making a living. But now the trend is changing where people are trying to focus also on their health. And so I think that if you spend time on your body, on your health, that is as critical or perhaps more important than chasing financial security, which is again got nothing to do with medicine. But I think that that's where the key lies. And as far as technology goes, we are perhaps advancing on two fields or two sides. One would be medicine to get the bone stronger, which there is the medical doctors will focus on. And as a surgeon, my interest lies in different modes of fixation, replacement, and earlier. So we have come a long way with fixing fractures also, like the implants have changed. They're stronger. We get patients up, we get them moving. We do replacements for fractures around the knee. We do replacements as we realize the bone quality is not good. In the past, we would try and fix them all. But then we realize that we are trying to fix something which has very poor bone quality. So the fixation doesn't hold. You're using good implants, but it has to still anchor into something. So that has changed. Now we are able to get implants that are, and arthroplasty has also changed. We got different ways of fixing in bone. We're doing it a lot quicker because the training is better. But that's kind of sort of where we are at this time. I think I think the next evolution will be the genetic aspect of it and the dealing with the bone quality and hopefully someday regrow cartilage, and maybe an injection will be there that helps just heal the bone instead of cutting somebody open. And so I look forward to that. Hopefully I can live to see that.
Well, thank you so much. It's a very informative session. I greatly appreciate your spending time with us and sharing your knowledge. And for people who are listening or viewing this, please talk to your own doctors about any issues that you may have. And if you wind up deciding you'd like a second opinion, the doctors from My American Doctor are available to you. You can make an appointment with any of us for further information. Thank you for attending this session. Best wishes.
Thanks, Kai. It was great.
Thank you. Thank you.